Hello, Mary. That looks tasty, but they are adding too much sugar. So let me guess. The topic today is about WHO recommendations about sugar consumption.
Hello, Thomas. Actually, I will talk about access to diabetes treatment. As diabetes rates soar globally, with a staggering 537 million people living with the condition, especially in lower-income countries, there's a pressing challenge. The cost of life-saving treatments, such as insulin and newer medications, is sky-high. A study published by Doctors Without Borders, Médecins Sans Frontières in the Journal of the American Medical Association, assessed the economic hurdles and highlights an urgent need for more affordable access to these essential treatments.
Affordable access to diabetes treatment. Does this research mean something for us?
This study addresses a key issue: the affordability and accessibility of diabetes treatments. It's crucial because millions around the world are struggling to access the medications they need to manage diabetes effectively. By examining the gap between manufacturing costs and market prices, the study points towards potential solutions that could make diabetes care more accessible to everyone, especially those in low and middle-income countries. It's about making a difference in the lives of those living with diabetes.
Yes, that's quite important. How did they analyze the situation?
The team conducted an economic evaluation, estimating the costs of producing insulins, SGLT2 inhibitors, and GLP-1 agonists. They aimed to determine sustainable prices for these medications and compared them with current market prices in various countries. This approach allowed them to highlight the potential for lowering medication costs through competitive manufacturing practices, thereby addressing the global challenge of making diabetes treatments more accessible and affordable.
And what did they find?
Can you believe it? The discoveries were absolutely stunning. The study revealed a huge gap between the potential manufacturing costs and the market prices of diabetes medications, indicating that treatments could be far more affordable with competitive manufacturing. For insulin, sustainable prices were significantly lower than current market rates. This was also true for sodium glucose cotransporter 2 inhibitors and glucagon-like peptide 1 agonists, suggesting substantial cost reductions could be achieved, highlighting the potential for generic and biosimilar competition to make diabetes care more accessible globally.
Wow! With such a stark difference in the potential and actual costs, what can be done to make these life-saving treatments more accessible to those who need them most?
The discussion in the study highlights the vast potential for reducing diabetes medication costs through the entry of generic and biosimilar competitors. This approach could dramatically improve global access to these essential treatments.
That's quite a revelation. Given these significant findings, what does the study conclude? And what are the recommendations for moving forward to tackle these issues?
The findings point to a pressing need for policy interventions that encourage such competition, potentially making diabetes management more affordable for millions worldwide. It's a call to action for governments and stakeholders to reevaluate and reform pharmaceutical pricing and access strategies. The researchers advocate for leveraging strategies used successfully in other diseases such as HIV and hepatitis C, and to push for policy changes that encourage generic market competition to ensure diabetes care becomes a right, not a privilege.
Indeed, the evidence is clear, and the path forward is marked. It's crucial now, more than ever, that decision makers and leaders around the world heed this call to action.